Hello there, in this video we will have a look at hepatitis B. It is a serious illness that is affecting millions of people in the world. But what is hepatitis B? How can we get infected with the virus? What are the causes and modes of infection? What is the line of treatment? We are going to discuss about these questions in this video. So, without any delay, let's dive into the video. Hepatitis B is a viral infection that attacks the liver and can cause liver diseases. It is caused by exposure to hepatitis B virus. Hepatitis B is passed from person to person through exposure to body fluids like blood, saliva, semen, vaginal secretions, etc. The common ways to spread this infection are through sexual contact, sharing needles, mother to child, even using contaminated hygiene items, for example toothbrushes, razors, nail clippers, etc. The infection, which lasts for less than 6 months, called an acute infection. Your immune system likely can clear acute hepatitis infection from your body. But, if it is not cleared due to weak immune system, the infection may last a lifetime, leading to serious infections such as cancer and cirrhosis. It takes minimum 2 weeks and maximum 1 to 4 months after you have been infected to show some symptoms. The symptoms are abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness, jaundice, etc. It can be prevented by avoiding unprotected sexual contacts. Do not share personal hygiene items. Avoid direct contact to any body fluids of infected person. If you have been exposed to hepatitis B, you can get post-exposure prophylaxis within 72 hours. Newborn can get vaccination to prevent infection. WHO recommends that all infants receive the hepatitis B vaccine as soon as possible after birth, preferably within 24 hours, followed by 2 or 3 doses of hepatitis B vaccine at least 4 weeks apart to complete the vaccination's eras. Protection lasts at least 20 years and is probably lifelong. WHO does not recommend booster vaccinations for persons who have completed the 3-dose vaccination schedule. The treatment for hepatitis B acute infection is not specific, but to maintain overall health. Chronic hepatitis B infection can be treated with medicines, including oral antiviral agents. That's it for this video, guys. I hope you enjoyed this video. See you in next video. Till then, do like, comment and subscribe, and help us to complete 1K subscribers.